Why do most doctors not address cardiovascular age? I think it really goes down to what is their approach? Most doctors are practice reactive medicine, meaning a problem happens and then they address it. Most patient doctors don't address it like preventative, right? Or a proactive way of actually addressing health. So they don't really care about your cardiovascular age because they're just going to wait till a plaque forms, or they're going to wait till your cholesterol just gets out of control and they need to address that, or whatever that might be happening. Welcome back to The Root Cause with Dr. Jake. I'm Dr. Jake Schmutz. I am an integrative doctor and naturopathic physician. And in this podcast, I have real conversations with real people to show you how to heal your body down to the root causes without any harmful drugs or surgery. I'm here today with my co-host and patient, Teresa Marie, where we're going to talk about HRV and PWV and how it correlates with cardiovascular age and health.
Dr. Jake, I am so excited to be able to talk with you today, especially also on this YouTube version, because I know that we have, and in the past we've done, the podcast where you and I chit chat a lot about, all the things that you are passionate about that you do to help your patients. And for the first time in a long time, we're bringing this part of the interview to YouTube so that we can be able to share this part with your YouTube audience, because it seems like people, they want to be able to see these conversations that you're having with real patients, and they get to feel like they get to be part of that conversation as well, which I think is really powerful. And I'm also really excited because I'm wearing an Oura ring, which I got about, I'm going to say 4 years ago when you were treating my husband for stage 4 cancer. And in our research of just trying to beat cancer through root cause methods like really helped us to be able to do, learned about the power of HRV, and some of in sleep, just all of the things that are help contribute to a healthy body. And it's really transformed his and my life when it comes to biohacking, like, you know, how do I improve my sleep? How do I improve my stress levels and so forth? During this time, it keeps updating. There's other softwares and tools out there like the Whoop and some other ones as well that are also measuring these things, HRV, PWV, and other types of elements. And people are starting to recognize them. What does this mean? What is HRV? Why is it important? Is that heart rate? No, it's not. It's actually something different. What's PWV? Maybe I should get mine checked. And so I'm really hoping that this episode really helps your audience and myself better understand what it is that we're seeing in our tools, our apps that we're using as we're trying to better understand our bodies. And for those people who haven't gotten one yet, but they're thinking about it, they're learning about it, they're better understand why these tools will be helpful for them. So with that, let's first talk about what cardiovascular age means and how does that differ from chronological age.
Yeah, so let's first talk about what is chronological age? Chronological age is just how old you are. You were born and now you're a certain age, right? That's chronological age. But that doesn't necessarily mean your cardiovascular system is that age. And that's what cardiovascular age is what is the health of your heart and your blood vessels compared to others. So you might be 40 years old, but you actually have a heart and blood vessels that are about like a 35-year-old, if it says your cardiovascular age is like 5 years younger, right? So you could actually be a certain age and your cardiovascular system could be a lot younger.
Well, I would like to show off that my Oura says that I am 7 years younger than I am in my cardiovascular age. So I'm very excited about that. I don't know why. Maybe because I'm trying to, get good sleep and not stress so much and eat healthy. But, hopefully we'll be able to unpack some of that when you talk about, how you can improve your cardiovascular age. So with that, then let's move on to our second question. Why do you think cardiovascular age is something that most doctors don't typically address?
That's a good question. Why do most doctors not address cardiovascular age? I think it really goes down to what is their approach? Most doctors are practice reactive medicine, meaning a problem happens and then they address it. Most patient doctors don't address it like preventative, right? Or a proactive way of actually addressing health. So they don't really care about your cardiovascular age because they're just going to wait till a plaque forms, or they're going to wait till your cholesterol just gets out of control and they need to address that, or whatever that might be happening. So that's really the main reason there is they're just not really focused on prevention and aren't even trained on what to do to prevent cardiovascular disease or any disease for that matter.
So then it seems to me like what you're saying is cardiovascular age and knowing it, tracking it, identifying what it is a form of prevention. You can use it as a form of prevention.
Yeah, so cardiovascular age is really great on using it a form of prevention. So some of us have these wearable devices, right? The Apple Watch, the Oura Ring, or whatever, and that could give us some basic information on our cardiovascular age. It's not perfect. It's decent. It could give us some addresses. Okay, I'm doing okay. It doesn't tell us that we're perfect though. And we're talking further on that.
So can someone without a tool like a Whoop or an Oura Ring, any type of tool that can measure some of these numerics that like HRV and PWV and those kinds of things, are there early signs that someone could see that suggest that they do have an older cardiovascular age even without having one of these devices? Or is this something like anybody who they might think that they're Mr. or Mrs. Healthy, oh, I'm doing great. And then they get this ring and they find out, no, I'm not. And they didn't have any symptoms of it. It's kind of a double question there.
Yeah, most of these things, like with cardiovascular age or whatever, or checking your HRV or your PWV, you don't really have a lot of symptoms of it. It's kind of like diabetes, right? You don't have a lot of symptoms that are related to these. It's a low grade, unsymptomatic thing that you experience. Now you can start noticing that your PWV, which is what measures your arterial stiffness, you can start to have symptoms of that because what happens with this is you can start to have higher heart rates. You could start to get high blood pressure. You could possibly start to have more difficulty going up the stairs than it used to be for you. You might start getting a little bit of chest pain. But just because you don't experience these symptoms does not mean that your arteries or veins or microvasculature is healthy, because usually it's asymptomatic.
Well, then I think that jumps into, I think that's a good way to kind of transition into PWV. What actually is this measurement? What does it stand for? And can you go into more depth as to how it actually is assessing your cardiovascular age and function and health?
Yeah, so if you have these biohacking devices or devices that are actually able to track these things, they use these sensors on them that have these PPGs, is what it's called, little light sensors. And it has an algorithm that goes along with it that measures your PWV, your pulse wave velocity, which is the speed of your blood transferring through the blood vessel. And this can tell us about the stiffness of the artery. So if we have a more stiff or rigid artery, you're older, your blood vessels are older. The more pliable they are or more elastic they are, the younger you are. So that's what's being measured by these devices, is just checking directly your stiffness of your arteries. It's not perfect though, because it's not directly checking your PWV. It's using these PPGs to estimate what it is. There are devices that you could go into the doctor and do more detailed PWV and it directly checks that. But the Oura Ring or whatever does a pretty good job. So you don't absolutely have to go into the doctor's office and spend a lot of money to get your PWV checked.
So then that makes me question for you, Dr. Jake, as a physician who cares very much about getting to the root cause of a lot of health conditions, helping people to be able to find and see signs early on so that they can prevent further problems. And then, of course, getting involved if there's already disease happening. Do you have tools that measure the actual PWV, or do you use something else?
Yeah, do I have a tool that actually checks the PWV? I don't do that a lot in my office because I do think that these biohacking devices do a decent enough a job, and I don't need to really look at that. I look at other factors. Okay, we see that your cardiovascular age is older than it should be. So you have more rigid arteries than you should have. Okay, that's one piece. But we also, what I like to really look at is all kinds of other laboratory tests or other imaging tests that we do to actually see what's going on. So there's a lot of different things, some basic things. We do a calcium score. We do what's called a TIBC, which is the CT scan. in which we could see the carotid artery. We can actually see the plaque and see changes that are happening in the plaque. Those are great things. Those are more basic things. Cardiologists know about this. But what I do that's more specialized and actually more preventative than this stuff is I actually check your glycocalyx. Probably most of you haven't even heard about this, which is sad and really surprising, especially in the biohacking world now, because it's probably the most important thing we have for actually testing the health of our blood vessels.
So we had PWV, and that one is, something that a lot of the tools are measuring. That's the pulse wave velocity that kind of estimates how elastic your veins are. More elastic, the better, because that means that your body's flexible, right? And it's able to pulse and move, and that comes with youth. We have the glycocalyx, which is the lining of those veins that they cannot get in their tools. They do need to go to a doctor's office like yourself, and we'll talk about how they can do that if they're interested. The other one that we do see on a lot of these devices is called heart rate variable, HRV. It's not heart rate, it's something else. Can you explain what that is, and how does it relate specifically to cardiovascular health? I know it has a lot of it can measure a lot of different things, but in the topic of cardiovascular health, how does HRV relate?
Yeah, heart rate variability is the differences of your heart rate. So you don't want the heart rate to always to be the same all the time, right? You want it to be changing throughout for certain stressors, for certain exercise, for sleep, etc. So that's telling us the health of your nervous system. That's what it's really telling us. And our nervous system is what controls our heart. So we have something called the vagus nerve, and heart rate variability is like the best thing we have to actually tell us about vagal tone. And so if our heart rate variability is not good, it's going to tell us about the health of our vagus nerve, which a big part of what the vagal nerve does is controls our heart, the electrical circuitry. So we talked about the blood vessels, but we need to also have the right signal going to the heart appropriately to make it pump correctly, or pump at the right times, or respond to stressors that are happening throughout our life so we get appropriate oxygen supply to the pumping action of our heart.
So, if I'm a stressed person, my nervous system is going to be struggling. My vagal nerve might not have as much tone because I'm just constantly stressed all the time. The way that I would understand it then is being like a stressed person with a nervous system that's just really struggling because I'm always in fight or flight. I'm probably also going to have a heart rate, not heart rate variable, but a heart rate that is higher because I'm upset or stressed, and that doesn't change a lot because I'm constantly in this mode. Um, is that a good way of understanding in some way how this relates?
Really stressed people definitely usually do have poor heart rate variability, but a lot of people, just because you're a stressed out person, which I am, I'm a stress guy. I think, yeah, I'm a very high stress. At least that's what the Oura ring tells me. I have about 6 to 8 hours of stress a day, at least. That's
Gonna have
being
to
at
start
work
doing
or at
some
home.
meditation
Sometimes
for
at
that
home
day.
it's even worse than at work, which I don't get. I don't feel stressed, but the heart is saying that I'm stressed. But my heart rate variability is very good because what I do is I make sure I get enough recovery. So
Okay.
I might be stressed, but I make sure my body recovers. So that's really what's important there. But yes, going into that point of, yes, you're a stressed person, you tend to have a poor heart rate variability because it's too high, it's all the time, and it's just staying there all the time. It's not variability. You're not having relaxation and then stress and relaxation and stress. That's what we want throughout the day, right?
Mm-hmm.
But if you're always stressed, that's going to be a big problem. And you're going to have a poor heart rate variability. And these biohacking devices are able to pick that up. And you're like, hey, I need to fix something. That's what's so great about it.
So let me better help better understand this, because I know that the heart rate and the heart rate variable are different things, even though that they relate, right?
Yeah.
What about in this situation, right? Where my husband, for example, has a higher heart rate on average than I do, right? My heart rate tends to average in the 60s. Nighttime, it can drop down to like even 49 to 50 when I'm in a deep sleep. And then in the day, it's like 60s, 70s. It can jump up. Like it can certainly get up into the 90s and the hundreds if I'm doing something like exercise. But for the most part, I'm a pretty like
Mhm.
mid 60s, low 70s during the day type of person, right? Where his average when he sleeps is at 70, right? And in the daytime, it might be more like in the 80s, and they can go up from there. So he might have, let's say, 80 as his heart rate, but then you go and check his heart rate variable, and the heart rate variable is actually a low number. It's not a high number. What does that
Mhm.
mean? Why is a heart rate variable? How can a heart rate variable be low and a heart rate be high, or vice versa?
So that's it. So what's the word variable or variability, right? It's the change. So there's not a lot of change there. It's 80 to 70. There's nothing happening there. It's like not a lot of variability is happening. So that's why, like I talked about in a previous episode, is you can help your heart rate variability with exercise. Because when you're doing exercise, you're getting your heart rate up to, like, if you're working out hard, 150, 140. So that's changing your variability. And then you want to make sure that you get good relaxation. Like in your husband going down to just 70, he's not getting great relaxation. He's not getting it down in the, especially during sleep, he's in the 70s. Like we should be at least in like the 50s. That's really healthy there because you're really calm, you're really chilled out. Like me, I have a really low when I sleep. I'm at 35, so my heart rate gets really chilled out. So I have this huge variability. I'm working out, doing a run at 150, and then I'm sleeping at 35. So
Right.
that's what's happening there is we've got this big variability, and it's showing us the health of the nervous system that is able to make these changes to what's ever happened in your life. When you don't have those variability, there's not a lot of changes happening to your heart rate, and it's just telling us that your nervous system's not working as well as it should.
Well, Dr. Jake, this has been so empowering to be able to know what these numbers mean on our rings, and also to be able to how to go and get extra information so that, we can actually get on top of this. Now, my last question really deals with somebody who might be nervous. Going into a doctor's office, getting a test like, a glycocalyx, for example, and maybe being afraid, like, what am I going to find out? What if I find out that my cardiovascular age is that of a 70-year-old when I'm actually 40? Like, that's scary. I don't want to know that. What would you
Yeah.
say to a patient who might be feeling those things and a little apprehensive about actually finding out, what is my PWV? Should I get an Oura ring? What is my HRV? Should I get a whoop? Should I go to the doctor's office and get my glycocalyx checked? What would you say to that person?
It's kind of like this idea that ignorance is bliss. And I hate that term because it's like, okay, you just don't know stuff. So you're just going to die. This crap is going to happen because you just don't know anything and you have a happy life. Okay. Yeah. Maybe you have a happy life, but then it was prevented all this crap that could have happened in your life if you were actually not ignorant about it. Right. So it's that type of idea. Knowledge is king. Okay, you might find out that you have an issue going on, but you would rather not find out what's going on and then you have a heart attack or stroke in 5 years, or you're able to actually find out what's going on and you're actually able to do some prevention. Because everything that I'm going to be testing in my office is we're going to actually be able to identify what's going on, identify the cause, eliminate that cause, and treat it effectively so that doesn't happen in the future. Okay, you have cardiovascular age of 70. We could bring that back to your normal age. So that's pretty empowering, right? That we can actually fix the issue, make you healthier so you're not going to have that heart attack or stroke. You're not going to have dementia when you're older, or you're not going to have chronic fatigue syndrome or whatever that can happen from our cardiovascular system not working appropriately.
What can I see happen to my HRV, and just start playing with some of those lifestyle changes to see if I can start changing my numbers and improving them. So for people who want to be able to get a hold of Dr. Jake and possibly get one of these tests done, or anything else related to their health that is concerning them at this time, you guys can get a hold of Dr. Jake by visiting and clicking the link down below, which is drjakewellness.com/schedule, and you'll be able to schedule an appointment with him there. He does both virtual as well as in-person appointments, so it doesn't matter where you live, you can definitely get Dr. Jake's expertise. You can also give him a call at 801-676-9876.
If you want to learn more about cardiovascular age, like your heart rate variability or your PWV, and you're watching YouTube, you could click my video to the right. I'm Dr. Jake, and I'll see you there.